Come on, John. You know I'm not comfortable going in front of the camera. Alright. At least let me clean my glasses. Hello. Welcome. I know you were probably expecting a clean-cut white guy to talk to you about health, not a blue fairy dude with a weird accent. But the world doesn't always work the way we want it to. I thought for the first time in front of the camera, we should talk about an important topic: cancer prevention. You know, cancer is definitely one of the most complex diseases humanity has ever faced. It can affect different organs, has multiple types, and a ton of risk factors. But that doesn't mean we can do anything to prevent it. The simplest thing is to avoid risk factors. For example, we all know that UV rays from the sun increase the risk of skin cancer. So it's best to avoid them as much as possible, or at least use sunscreen. Think of it this way. Every time we get sunburn, the DNA in our cells gets damaged, and the cell has to repair it. If it fails, the cell undergoes apoptosis and gets eliminated. Our body is really good at getting rid of defective cells. Otherwise, we'd be getting cancer every day. But sometimes it can mess up, and a cell can become cancerous. The more you repeat this cycle and get sunburn, the higher the chance your body might make a mistake in eliminating cancerous cells. It's obvious that smoking and excessive alcohol consumption significantly increase the risk of cancer. Sometimes these factors interfere with the DNA repair mechanism that we talk about, leading to cancer. But let's say you're avoiding risk factors. What else can you do to lower your cancer risk? The first is getting vaccinated against viruses that are risk factors for cancer, like Hepatitis B and HPV. Unfortunately, in some countries, the HPV vaccine isn't part of the national vaccination program, so it might be expensive. But whether you have been vaccinated or not, the best thing is to avoid high-risk sexual behaviors to reduce your exposure to HPV, HIV, and a bunch of other diseases. The second effective step is having a balanced and nutrient-rich diet. A diet full of vegetables and fruits packed with antioxidants, whole grains, sufficient protein, and unsaturated fats, with very little processed food. If you combine this with enough sleep and regular exercise, you can say you've been successful in reducing your cancer risk. In fact, the studies show this can add about 5 to 10 years or even more to your life. And you'll be ready to meet your great-grandkids. We'll definitely talk more about cancer in future videos. Until then, take care.